Over a third of older adults fall each year, and 1 out of every 5 of those falls actually can result in a serious injury like a broken bone or a head injury. In fact, 2.5 million older adults present to the emergency department every year with a fall. And in many emergency departments, including ours, fall is the most common reason for an older adult to come to the emergency room.
Would your suspicions be raised at certain points about the explanation of a fall? And if that's the case, could you tell us what might generate those suspicions?
Sure. So sometimes when a patient comes into the emergency department and they say, "I fell," or when someone is brought into the emergency department and a caregiver or a family member who's standing next to them says, "They fell," there are certain times when I am suspicious and I wonder whether or not that is the actual explanation for what happened. And for me, it might be, for example, an unusual or an inappropriate interaction between the patient and the caregiver that I witness. Or it might be a behavior of the patient, him or herself, that makes me concerned. Also, in my examination of a patient after they fell, I'm trying to look for things that I might be concerned about. The first thing is, are the injuries that I'm seeing consistent with the mechanism? In other words, when I see a set of injuries, do they seem to comport with what the person told me happened? Are the injuries something that I think might be occurring from the type of fall that they're describing? Also, I'm looking for injuries of different ages. Am I seeing not just injuries that look like they might have happened today, but also injuries that look like they might have happened a few weeks ago or a month ago? And if both types of injuries are together, sure, this person might have fallen multiple times, but again, that might be something that I want a better explanation for. In addition, there are certain types of injury patterns that I might be looking for that I think are pretty unusual. For example, I might be looking for patterned injuries, or bruises on the ears, or bruises on the back of the neck, areas that are uncommonly bruised in a fall, that might give me a clue that I maybe need to look more closely and evaluate more deeply.
I'd like to follow up a bit more on that, because in many types of abuse cases, the defense that a prosecutor is going to get from a defense attorney is that it was an accident or that it was self-defense of some sort. And so when you think about what you just said about the unusualness of an injury or the pattern nature of an injury, could you elaborate a bit more on what might be indicative of an injury being an accident versus self-defense or some sort of intentional injury perpetrated by an abuser?
So I'll tell you a little bit about research that's been done by Dr. Mosqueda and Dr. Wigglesworth and others. They looked at bruises, and they found that bruises in victims of elder abuse are likely to be larger than 5 centimeters on the posterior torso, on the right lateral forearm, or on the face. And not only are these likely to occur, but they're more likely to occur in abuse than in victims that weren't abused.
What about bruising? That is something that prosecutors encounter a lot, and I'm wondering what sort of advice you can give to prosecutors evaluating a case where there's bruising. So for example, a question I frequently hear at training is can you tell the age of a bruise from its color, for example?
You know, that's a great question, and unfortunately, Dr. Mosqueda and her colleagues have actually shown quite convincingly in a recent study that unfortunately we cannot. And so the color of a bruise is not a reliable way to identify its age. Many of us that care for victims of elder abuse as part of our clinical medical practice will tell you that it is suspicious to see certain types of bruising patterns. And those can include bruising that isn't over bony prominences. And I'll stop for a second to explain what I mean by that. We typically bruise over places where our bones are exposed. We typically bruise in places where the bones are right near the surface of our skin. We are less commonly bruised on areas that don't have bones near the skin. These are places like the neck, like the ears, like certain parts of the back, like certain parts of the chest and certain parts of the mid-arms. Are any of these going to be definitive for elder abuse? I'm afraid not. But are in toto, can they add to a picture that might be suggestive of elder abuse? Absolutely. Are they things that we want emergency physicians and other healthcare providers and also law enforcement personnel and prosecutors to be aware of and cognizant of and suspicious for? Absolutely.